Here, okay. Then I can start now. May I start? Okay, okay. Thank you. So, um, at the outset, let me convey my sincere regards to the organizers, Dr. Lilith and Dr. Manju, for inviting us for sharing our perspective regarding Ayurvedic dermatology clinical practice. Actually, um, uh, 2 years back, we have started the session regarding Ayurvedic dermatology based on our clinical practice. In Kerala, we are practicing this Ayurvedic dermatology very successfully, and based on the experiences, we have um, given permission for that session, and successfully they have conducted this course for more than 200 doctors, and we are getting good feedback from them that they are practicing Ayurvedic dermatology very effectively as per the principles of these treatments, and as per the learnings given by us, they are very effectively practicing this Ayurvedic dermatology. Still, after 2 years, they are having intimate contact with us. They are sharing cases with us, and they are getting proper feedback from us. And that team of doctors who attended this dermatology class, they are very successfully running their clinical practice. We are proud of them. So let me convey again our sincere gratitude to the organizers for inviting us for taking this course. Actually, this session, this course is designed in such a way that every delegates or every doctors will get basics of Ayurvedic dermatology, how we have to approach these cases, and how we have to treat these cases systematically. That word is very technically, that word systematically or scientifically, that term is very important, relevant, because nowadays we have to do our clinical practice in line with the scientific methods and a systematic way. So, how we can arrange the systematic or scientific way of Ayurvedic dermatology, that will be studying, that will be teaching in this particular course. So, once again, let me convey my sincere regards to the organizers. So, let me start the session now. So, before entering into the session proper, let me show some images or dermatological cases, because these are the usual cases coming to our OPDs. It's a kind of eczema, bullous rashes. So it's a type of eczema, chronic lichenified lesion, lichen simplex chronicus. So folliculitis case, and exfoliations, urticarial cases, scalp seborrheic dermatitis case, and Akin case. It's also pediatric skin, alopecia, prickles. It's another type of ulcer. Eczema case, say edema with exfoliations. And so, as per the principle of Ayurveda, if you refer Ayurvedic textbooks, in order to create a separate chapter for Ayurvedic dermatology or separate branch for Ayurvedic dermatology, we can collect various cutaneous manifestations from different Ayurveda prakaranas. Starting from Jara to Vadarekta, there are different prakaranas. In different prakaranas, we can see different cutaneous manifestations. Sadhyovrana, Agnidagda, Visha, Doshi Visha, Abhigadaja Shobha, Vishaja Shobha, Udarda, Shitavitta, Visarpa, Vidradi, Kushta, Uttanavadarekta. In all these pragaranas, in all these pragaranas, we can have ample references regarding cutaneous manifestations. So, in that cutaneous manifestations, see, um, starting from Jara, this Kabhaja Jara Lakshana. Among the Kabhaja Jara Lakshanas itself, we can see some Udarda Lakshana. So, whenever you are trying to create a separate chapter for Ayurvedic dermatology, you have to collect various pragaranas, you have to collect various references from various pragaranas, and you have to collect references regarding treatments also. Treatments also. What are the basic principles to approach these cases? What are the basic principles to treat these cases? What are the basic principles to frame the samprapti of each and every conditions? What are the principles or practices applicable in these conditions? We have to collect the references from different pragaranas. So, in our course, we are trying to give all these references from different pragaranas so that a practicing doctor can be aware about these scientific details from different pragaranas. I think you are getting my point. So whenever we frame Ayurvedic dermatology, we have to collect different. We have to combine the principles of diagnosis, and we have to combine the principles of treatment from different pragaranas. And in this course, in this session of 28 days, we are trying to provide all these references together in a course so that the delegates or doctors can attain a thorough knowledge regarding Ayurvedic dermatology. Thorough knowledge regarding Ayurvedic dermatology. What are the principles that can be utilized? What are the treatments that can be utilized to practice Ayurvedic dermatology? From different pragaranas, we will compile and we will provide all these references, and we will share all these references and all these principles and practices. So, in our course, we are designed. We have designed this course in such a way that every delegates or every doctors can attain the knowledge regarding basic principles itself. Starting from basic principles means clinical anatomy. What are the relevant points regarding Ayurvedic dermatology that we can collect from clinical anatomy, clinical physiology, practical tips, not all the theoretical backgrounds regarding anatomy and physiology we will explain. We will not explain the theoretical backgrounds, but practical tips regarding these anatomy and physiology. What are the practically relevant tips from anatomy and physiology? Because while we deal with the clinical cases in our consultation room, the basic anatomical and basic physiological details becomes relevant in such a way that pathology or the evaluation of skin require these details. So we will provide the basic clinical anatomy and basic physiology. Along with that, integumentary system examination, that is a relevant factor. How we have to take the history of a dermatological case. General history is there, specific history is there. For example, if a patient from a particular area where some particular disease or dermatological cases are prevalent, in such situations, we should know what are the prevalent diseases in that area. So, how we have to take the geographical history, how we have to take the specific history or the nature of that particular issue, and what are the primary lesions, what are the secondary lesions, and basic details of the lesions will be discussed in that session. Various types of dermatological issues are there. around 3,000 terminologies, around 3,000 terminologies regarding the dermatological issues, skin diseases are there. Among them, we will focus some particular issues commonly coming to our OPDs. Different types of eczemas, different types of infective skin diseases. Eczema itself, atopic dermatitis is there, irritant dermatitis, allergic dermatitis, various types of causes, and how we have to approach these cases. What should be our treatment approach in these cases? What is the mainstream medical methods they are doing? And viral infections, bacterial infections, fungal infections. What should be our approach to diagnose these cases? And what should be our approach to treat these cases? Different types of psoriasis are there. Guttate psoriasis, plaque psoriasis, scalp psoriasis, like that. So many types of psoriasis are there. How we have to diagnose? How we have to differentially diagnose lichen planus cases, pemphigus vulgaris cases? What are the morphological features of each and every skin disease? How we have to differentiate from one from another? And diseases of hair and glands. As you know, nowadays patients are very conscious about their health issues. Among them, the trichological issues. Trichological issue means issues of hair or glands. Trichological issues are very common nowadays. So we should know the different types of hair issues. What are the issues affecting this hair as a prakriti, as a natural, as a nature? Patients, individuals may have different types of hair. So how we have to differentiate from nature and abnormality or pathology? All these matters will be discussed in this session. And as you know, pediatric skin is a unique skin. So developmental errors will be there. What are the developmental issues of a pediatric skin? How we have to diagnose each and every individual cases? How we have to approach these cases? What should be the treatment approach? What are the specific treatment methods? As you know, in Kerala, we are having unique treatments for pediatric skin. Bala Visarpa. Bala Visarpa is the particular category of cutaneous manifestations explained in Kalpadruma. Arogya Kalpadruma is a specific unique textbooks available in Kerala. We treat different types of pediatric skin cases with the help of Arogya Kalpadruma. So, with the help of Arogya Kalpadruma, we will be explaining different types of specific drugs, effective drugs to treat pediatric skin. Instead of steroid management, how we can manage without using steroids pediatric skin. Like that, geriatric skin also. Geriatric skin issues are very common nowadays due to the dehydration, due to the atrophy, due to the atrophy of skin, and due to the dehydration of skin. Uh, geriatric skin geriatric skin complaints are very common nowadays. So how we have to approach these cases with the principles of Ayurveda? We will be explaining in that session. Various types of pigmentary disorders are there. Vitiligo and the uh, maculopapular derangements, leukoderma, leukoderma rashes are there. So vitiligo and leukoderma, how we have to differentiate and how we have to address these cases and what should be our approach? See, nowadays so many patients are coming with a pigmentary disorder after using some cosmetological preparations also. So, what should be our approach in dealing with these cases? After cosmetological applications, what are the complications, and what are the allergical rashes like pigmentary disorders, and how we have to deal these cases. See, our mind, our mind is having a close relationship with our skin. Stress factors can trigger skin disease, and skin diseases also can trigger psychological issues. Some inhibitions, irritations, stress factors, all these stress issues can trigger psoriasis, lichen planus, eczemas. So there is a strong relation between the our psyche and skin. So what are the interconnections between psyche and skin, mind and skin? And how we have to approach these cases? What should be our approach in treatment? Psychodermatology is an evolving branch of medical science. In medical science, in modern medical science, they are evolving. They are creating new branches of psychodermatology. So years back, years back itself, we have created approach regarding psychodermatology, and what should be our approach regarding these cases will be explained in that session. And as you know, in various systemic diseases, cutaneous manifestations are very common. For example, in thyroid dysfunction, we can see dry skin. In diabetes, we can see recurrent carbuncles or recurrent sebaceous cysts. Like that, in liver dysfunctions, chronic pruritus may be there, itching may be there. Like that, cutaneous manifestation may be due to systemic illnesses. So we have to identify the primary illness or primary issue, primary systemic illness inside the body. So what are the cutaneous manifestations? What are the interconnections between the cutaneous manifestation and systemic diseases? Every physicians, especially dermatologists, should know the systemic relation between skin and internal atmosphere. So in that session, we will be explaining all the cutaneous manifestations related with the systemic disease. And obviously, investigations in dermatology. In a dermatological issue, what are the unavoidable investigations? Unavoidable investigations. By doing an investigation, if you get relevant informations, regarding systemic pathology, that would be uh, very effective in your clinical practice. So what are the relevant investigations that should be done in a dermatological issue will be explained. And in Ayurvedic profile, as you know, all the delegates or doctors, they will be practicing dermatology, and while practicing Ayurvedic dermatology, uh, we should know the profile, how we have to connect the basic principles of Ayurveda with the dermatological issue, with the case before you. So, how we have to bridge the gap between theory and practice? We are having so many basic principles: dosha, dushya, srodas, agni. So, how we have to connect these principles with the dermatological principles? That will be explaining in that session. And the Nidana Samprapti factors, different types of cutaneous manifestations with the example of Kushta. So many types of terminologies are there. So all the types of cutaneous manifestations described in Ayurveda will be explaining in that session, and how we have to select the treatments or treatment principles, how we have to frame the treatment principles in each and every cases. As you know, the rationale behind the selection of drugs, Uluchadi, Nimbadi, uh, Mahadiktaka, Tiktaga, like that, so many medicines are there. Aristas are there, tablets are there, Girdas are there, Kashayas are there. So rationale behind the selection of each and every individual drugs. What drug we have to select in which condition in in particular specific condition. Systematic and scientific selection of drugs. We should know, we should study the systematic and scientific selection of drugs. That will be explaining in a systematic way in this course. At the end of this course, I think the delegates or doctors will be having that particular protocol, especially many delegates who attended in previous sessions, they called us to convey their regards uh, about the knowledge or the scientific selection, rationale behind scientific selection. They told me that already they were having the knowledge of many drugs, but the scientific knowledge where and when they have to select these drugs. That scientific knowledge we will share, and that will be really a boon to your clinical practice. That will really help you to select scientific and systematic treatments. In a topical, various topical therapies are there. Different types of dhara, different types of kashaya applications, lebana applications, chara karmas, and churna kalpanas, shastika pinda swedas. All these therapies, topical therapies, rationale behind the selection, clinical indication behind the selection of each and every different topical therapies will be explained. And Rektamoksha. Obviously, Rektamoksha is a particular skill that should be attained by every practitioner while doing this Ayurvedic dermatology practice. Prachana, Siravedha, Jalugavajarna, Kuttana, all these factors are there, all these particular applications are there. Rationale behind the selection of Rektamoksha, clinical indication for each and every particular condition. So, in a patient with a skin disease, you may be selecting Jaluga Vajarna in a particular clinical condition. For another patient, you will be selecting Siraveda. For another patient, you will be selecting Guttana. So, what are the clinical indications specific for them and the rationale behind the selection? How these rectomoksha procedures are doing their intended action? What are the objectives behind the rectomoksha? So, these procedures we will show video clips of the rectomoksha procedures will be there, and obviously in Ayurvedic clinical practice, pathyapatyas are very important. What are the aharas to be advised? What are the aharas to be avoided? In Ayurvedic clinical practice of dermatology, the pathyapatyas are very relevant. We should know the exact details about patyas. What are the apatyas? All the details about pathyapatyas will be discussed here. And after that, we will enter into some special case discussions. Nearly 20 or 22 cases we will discuss, special cases. What should be our approach? What we have given, and what were the responses? What were the responses? And what is the scientific explanation behind that? What is the scientific explanation behind these practices? And skin allergy. Skin allergy, Ayurvedic perspectives, case discussions also will be there. Different types of external allergies, different types of foreign materials are there. And in these materials, what should be our approach and what should be the treatments, all will be discussed here. And a special session regarding Rasaushadhas. Two sessions, part 1 and part 2, regarding Rasaushadhas. Actually, in our course, the session regarding Resaushadha will be dealt by Dr. Jitesh MK, uh, physician at Kottakkal Ayurved campus. Kottakkal Ayurved campus is a famous institution in Kerala. In Kottakkal Ayurved campus, he is doing an excellent practice in Resaushadis. So Jitesh MK, Dr. Jitesh MK will explain the the practical utility of Resaushadis. Before that, the session about anatomy and physiology will be dealt by Dr. Vandana. Modern session, modern dermatological sessions will be dealt with by Dr. Abdul Rauf sir. Abdul Rauf sir is a uh, eminent clinical practitioner at Ollur Ayurveda College, and he will deal with the modern parts. And Dr. PM Madhu, I will be explaining the Ayurvedic parts. So basic cosmetological concepts. Next session. Dr. Vidya, famous cosmetological practitioner, Ayurvedic practitioner. She will be explaining the basic cosmetology and Ayurvedic cosmetology. And obviously, Ayurvedic trichology. Trichology, as I explained, the issues of hair and glands. Patients are very conscious about that. They are concerned. They are concerned. We should address their concern. We should address their concern. So, various issues of hair, we have to know that. We should know the issues of hair and basic principles of trichology and how we have to manage these cases. See, the hair growth cycle, anagen phase is there, catagen phase is there, a telogen phase is there. So, how we have to improve the anagen phase, how we have to reduce the telogen phase, like that, the in line with the modern trichology, how Ayurvedic physician should address these cases. That will be explained in that session. Yes, Ayurveda in practice. Practical tips regarding trichology. That will be explained in that session. Along with that, after this 1 hour session or each and at the end of each session, there will be question answer session. Question answer session. The queries regarding that particular session will be asked in that particular session itself. At the end of each and every session, there will be a question and answer session. And at the end of this course also, there will be sessions regarding question and answer session. So, if you are having queries regarding these sessions, you may write down these queries, and at the end of the session, there will be particular session. Along with that, we will provide some PDF format of some important dermatological textbooks, so that you can gather extra knowledge regarding dermatology from all these PDFs. 2 or 3 textbooks regarding dermatology. Color atlas of dermatology will be there. Details of dermatological issues, the cases, complaints will be there. And etiological issues also will be there in some textbooks. 3 books I will share. So these are the details of our course. So at the end of this course, I think the objectives of this course, instructional objectives of this course, each delegates or each practitioner or each doctor can get ample knowledge regarding the basics, from the basics of dermatology to the clinical practice level. What are the specific or unique treatment methods that we can incorporate in our clinical practice? So this module is designed in such a way that at the end of the session, every delegate would get complete knowledge regarding Ayurvedic dermatology practice. So let me conclude this session. Once again, let me convey my regards to the organizers of this course for giving us the opportunity to share our perspective regarding Ayurvedic dermatology. And I am sure, I am very sure that each delegate would get ample chance to get complete knowledge regarding Ayurvedic dermatology. So thanks a lot. Thank you once again. Hello, 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 hello. Uh, in chat box, or directly. They can ask in this format. They can ask. The audio is available there for them. Direct. They you can unmute or I how I can unmute. Yeah. Okay. 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 You can ask Dr. Manmeet. Hello. Hello. Can you hear? You may ask Dr. Manmeet Singh. You can ask. Hello, Doctor. Yeah. Can you hear? Hello.
வேலைதான் பண்றாங்க வந்து செய்யல.
Audio is not proper. Hello.
அதான் செய்யுது. யோகா கிளீன் பண்ற வேலை.
Hello. Audio is not proper. Hello.
வெளியே போயிருக்காங்க.
Sound is not proper. Can you type in chat box? Hello?
வேலையை பாருங்க, வேலையை பாருங்க.
Sound is not proper. Hello?
ம்? நாளைக்கு வந்தாலும் செய்யுங்க, நாளை கழிச்சு வந்தாலும் செய்யுங்க. அப்ப நான் வந்துட்டு கூப்பிடுறேன். சேர்ந்து தான் செய்யணும், தனியாலாம் செய்ய முடியாது.
Hello?
சரி. ஹலோ.
Yeah, their sound is not proper. Okay, okay.